I want to introduce Dr. Rocker. Some of you may have met Dr. Rocker. Some of you may know his children. And Dr. Rocker has really been a helpful resource for the entire SAR community throughout the entire episode that we're going through. We've had, some of you may be aware, we've been having on Monday evenings town hall meetings really for parents and community members. I think a bunch of kids have joined, but they've been directed for parents. And Dr. Rocker has really shared a wealth of information, being on the front lines of affecting the entire situation. And so what we're going to do is hear from Dr. Rocker. He's talked to parents, but he's going to talk to kids. He's going to talk to kids now. And so with that, I hand it over to Dr. Rocker. Please use the chat box to ask questions. I'll be keeping an eye on the chat box, and everybody can, I'll try to, there'll be time for Q&A at the end, but I'm handing it off to Dr. Rocker right now.
Hello, everyone. How are you? So welcome and thank you for joining, although I don't think you had much of a choice. And yes, some of you know me. Some of you I've sutured in my own house. So welcome. I think when I have spoken to parents about this, I take a certain tact, and I think speaking to kids, it's appropriate to take a different tactic. Let's just be honest. This totally sucks. I mean, this is absolutely horrible. Insofar as our lives are completely disrupted, right? People who have jobs, many of them are staying home. People who have jobs that are essential are now going to work and are scared, right? They're scared that they're going to be put in situations that they can't handle because doctors are being stretched and told to do things that they usually don't do. I'm a pediatric doctor. I am taking care of adults right now. Even though y'all think that, you know, we went to med school, we learned everything, I don't know adult medicine as well as adult medicine doctors do. So the hospital is completely stretched. You guys are home. You're being told not to see your friends, not in like a video way. That stinks. And so I want to address that, the suck, and I also want to address why the measures are so drastic as they are. So I think it's very hard for people to understand why we're taking such dramatic, efforts when you look outside and it's nice outside and you see people riding their bike and you see people walking and you see people taking their dogs out there and you don't see any tragedy, right? These aren't the photos of Syria where like buildings are just destroyed. And so you have some people saying it's like a war zone, but to you, it looks pristine and fine. And so it doesn't make sense why you're being asked to stay inside and have all these social distancing things in place. So let me tell you what I experienced yesterday. So I am a pediatric ER doctor. I'm the director of the Children's Pediatric Emergency Department at Cohen Children's Medical Center, which is like on the Queens-Long Island border. And I also work with the adult side during this time because they're in crisis. Their ED was 100% full. Their waiting room was 100% full, and we were using the lobby as an emergency department. This is a lobby that usually, they're giving out, water and making sure everyone feels good. It is not a feel-good place anymore. People are wearing masks. There are signs everywhere. And I walked into that lobby to see someone seizing because, they're not just mildly sick patients there. There are sick patients in the lobby as well. So the difference between looking outside and seeing a totally nice day and the experience in the hospital is dramatic. Another thing they did yesterday is they now have 2 patients per room, which is not per single room, because they don't have enough space. The Children's Hospital has given 50% of their space to the adult side. My emergency department is now cut in half because we're giving space to the adult side. I know all that sounds like, oh, numbers, I'm not so sure, but you need to understand that what is really going on in the hospitals is extremely, extremely dramatic. And I'm talking to doctors who are 60, 70, 80 years old, and they have never in their life experienced anything like this. And we're not at the peak yet. So it is only going to get worse. Okay, so that was the bad part. That was the scary part. I'm done with that. So the reason the suck is here is because in reality, it is a scary situation. So what I want you guys to understand is all that you do, right? All that you do, which is annoying, what you're being told to do, which is annoying, which is don't get together in groups, is hugely important, right? It's important because when you get together, there is a little bit of a risk, right? But then you take that risk back and you bring it back to your family. And then you bring that risk back, and if you're seeing any grandparents or anyone else, then that risk is really significant for them as well. And we want to cut that down. We do not want people to be exposed. And this is going to last a little bit of a while, right? It has already, and the problem with you guys versus other members or other people in New York is it started at SAR. Insofar as you guys have been in quarantine for a long time and you're feeling the pain, and I totally get it, and I'm sympathetic, and I'm sorry. But unfortunately, we need to continue doing this because it is extremely important. So I know people are going to ask questions in the chat, but wait, can we get together at a distance? Everyone has little nuances to their questions about how it's slightly better. In general, the answer should just be no. Every little thing that's a little closer to getting together has an added risk. And that's something that we don't want to accept right now. And I know it stinks, and I'm sorry about that, but I'm telling you the importance is gigantic. So what can you do right now, right? And I think it's really important to, and I want to address this, and I know SAR has addressed this, and I know the last speaker on Monday night talked about happiness. I think the mental health part of this is really important to address, because you may be feeling a lot of stress, you may be feeling fear, you may be feeling anxiety, your parents, your grandparents, whomever you speak to, the media, everything around you is sort of vibrating at a really intense way. And it's impossible to be immune to that. It's impossible to not feel that, right? So what I want to say is that's fine. All of us are stressed. All of us are anxious. All of us are scared. I am, as my role, in the emergency department, it's also part therapist, right? Insofar as I have staff members coming to me with various things. Staff members are crying. Staff members are telling me about the stresses that they're experiencing. And so you guys are, are in this pool, right? This is a highly stressful experience. Again, unlike you have ever experienced before, and unlike your parents have ever experienced before, for the most part, right? And so this is a burden for everyone. And so if your parents act out in a way that is atypical for them, have a little bit of understanding. And we have mentioned this to parents, and if your kids act out in a way that's a little atypical for them, they should have understanding to that as well, because we are all nervous and scared, and we can't always control our emotions and not only our emotions, we can never control our emotions, but we can't control how it affects our behavior sometimes. So I understand the stress that everyone is going through, and please feel free to reach out to people and talk about it. Sometimes that just helps, just to be able to hear that, to have it validated by your friends, by your family, by someone, right? So that 100% is important. Other things that I think should be done during this time is create a little bit of a schedule. I'm not a schedule person. I hate schedules. I kind of just do, what I have to do at that moment. But at this time, I actually have been jogging more, and I've been exercising more, and I've been finding the time to do that, because it's important to have some you time, right? So what you have to do is carve out a little time for you, and be that go for a walk by yourself, or if you're not a solitary person and you want to, do it with someone else, well, you got your iPhone, you got your phone, you could do that. Or, if you just want to be secluded in your room for a little bit and talk to people, do that. But also control the conversations to a certain extent. After a while, if you find you're just spinning in that swirl of coronavirus hell and everything is stressful, be like, hey, you know what? We've talked about this enough. Let's talk about something else. There are, I'm sure you guys are getting it, there are enormous jokes coming out. There are great TikToks, there are great memes, there are great YouTube videos that are just kind of making light of various things that are going on. Enjoy those, right? Create one. Another thing that may be kind of interesting is keep a diary, because your kids are going to ask you about this time. And being able to say like, oh yeah, I wrote about it, that may be a great thing. So for some of you, you're like, that's crazy, I'm not going to do it, understand. And for some of you, that may be like, yeah, that may be a good outlet for me. So I think it's a good thing to consider. Another thing to do is potentially even pick up a hobby, right? YouTube has so many possibilities for learning different skills. And it's not like if you don't have a guitar in your house, you're not going to learn how to play guitar. But if you've never played chess and you want to learn how to play chess, learn how to do things like that. That may be helpful. So I'm trying to give suggestions to how to get through the day, because it is stressful knowing that you can't necessarily get together with the friends that you usually do. And that's your venting time, right? You can do it, but it seems in a slightly different way. It's going to be on the video chats. Right? It's not as authentic. Okay, it's not, but guess what? It's the authentic of today. It is what it is today. The other thing, and this is going to sound ridiculous coming from an adult telling this to a child, like to adolescents. Your house is stressful. I'm not like everyone's house right now is stressful. The parents are feeling stress. The other children are feeling stress. And what you could do also, and I feel like I may kick myself for saying this, is potentially step up and see what you could do in the house, right? Be the mensch in your house that, just because your parents are stressed about something, they have to deal with their finances and dealing with the kids and dealing with all these Zooms. Offer to make a dinner. Clean up the table without being asked. Try to help with the other siblings if you can. Again, I want you guys to, because sometimes by doing good, you feel better. Not sometimes, almost always, right? By doing good, you feel, I'm taking a burden off someone else. I have responsibility during this time. I have a responsibility. When I wake up, it's not just I get through the day, but I have responsibility to my little sister, or to, my mom or my dad during this time, or my grandma, or you know what? I'm going to make an effort to call my, isolated relatives every single day. I'm going to make an effort to call my grandparents, every day. Make that a responsibility and stick to it. And I think that may be something that you're going to feel good about down the line. I'm going to pause there and sort of open it up.
Dr. Rocker, I've got a few questions that have come up. So I'm just going to ask you a bunch of them together, and you can, instead of going one by one. Questions have come up about, should we not go outside at all? If we do go outside, are we allowed to hang out with friends? If one friend, if they're more than 6 feet away from us, that's like about going outside kind of questions. The other questions were about people in my home who may be immunocompromised. If I'm immunocompromised, how do I deal with this differently? In my home, how should we be dealing with it differently if one of my siblings is immunocompromised? Somebody else asked if is it okay if I'm not totally freaked out? If I'm feeling kind of like I'm trusting the doctors and that the people got this taken care of, should we be trying to wear masks if we go outside? That's really about that. That's a lot of the questions. And then I think there's questions about sort of like policy and prognostications, like any sense in trying to imagine like whether summer camps will open, at what point you think school will open, have we flattened the curve at all, is what we're doing having any kind of effect? Those are some of the questions that were asked, so I'm gonna kind of let you try to respond to those.
Yeah, so first and foremost, what we saw last week was a slight flattening of the curve, which means that everything that you are doing is working, because you can't flatten the curve without people practicing good social distancing and all the strict sort of procedures that we're asking people to do. So everything that you are doing is working, period. We are seeing that. It doesn't mean we are out of the woods. We are not even close to being out of the woods. It is going to get worse, but the actions that you are taking are making a difference. 2, outside. God bless you. Go outside. Mental health wise, it is, for some people, it is a panacea, right? You go outside, you get the sunlight, you're in the fresh air, you're seeing the trees, you're seeing, nature. That uniformly, and again, it was Dr. Santos on Monday made reference to this, it changes your being, right? Seeing the nature just, and it is a benefit to your immune system. So potentially, gives you a little bit of an up, God forbid if you were exposed to the virus or not. Getting together. No. So sorry, because I can tell you what I see through driving through my neighborhood. People aren't practicing social distancing. They are sitting, oh, we're gonna get 6 feet apart, but oh shit, did you see what's on my phone? Next to you're a foot apart. So the answer is the temptation is too high. So no, I would not do it, because in the end, you will be next to each other. So don't do it, because it's not gonna be practically realistic. Go outside and FaceTime each other. Go outside and do whatever you do, because then you're with each other and there's not that temptation to get closer. Okay, you can even joke about it. I'm outside of your window. Like do that. Mix it up and have fun with it. But getting together should not be done at this time. Freaked out. You're not freaked out. Cool. That's awesome. As an ER doctor, I see a lot of things and people leave the room and are devastated. I'm like, that's just my disposition. So we all have different emotional bandwidths. And if you are seeing this like, okay, this is just a thing and I'm going through it, good for you. That's awesome. You have, an emotional, guiding post that is really beneficial to you right now. So if you're on the extreme where you're freaking out, okay, good for you. Like that's what your body needs. That's what your mind is telling you, needs to be done, and that's how you vent. Okay, talk to people about it. And on the other side, you're feeling nothing. Great, you're somewhere in the middle. Great, that's who we are. All those are fine. Masks. If you have access to a mask, there probably is some sort of benefit to wearing for a mask, especially if you are out and about. If you're going for a jog and really not interacting with people, I don't think it has much of a benefit. But if you are going to a supermarket, if you're going out and shopping, but in general, when people are shopping, they should shop one person at a time, right? You should not go like, hey, let's have a family outing, all 6 of us, let's get in the car. Because then all 6 of you are gonna have slightly different experiences when you go out, and you're gonna be touching different things, and you're gonna, bringing, greater risk into the house. So I would not go out, it's one at a time. Immunocompromised. Okay, 1 second. I don't know where it is. So in regards to immunocompromised, I don't think it's here. In regards to being immunocompromised, you are at higher risk. Just like if you were a diabetic, have obesity or hypertension if you're in the adult population. Because of that, you just have to be a little bit more cautious. If there are others in your household, be more cautious. And then I don't know if Pesach was going to come up, but the answer is no. Many people have called me. I can't tell you the number of texts and phone calls I get. What about this situation? And for the most part, the answer is going to be, guys, I know this stinks. This is the big suck right now. And the answer is no. It's going to be a nuclear family Seder. Other questions? Oh, camp, I am not a policymaker. Prognostically, I have no clue what is going on. Each camp director is going to be making those decisions, and I don't think they'll be calling me. But I can tell you this is going to last for a while, right? If we're not at the peak, that means we're not 50% done yet. So that's not news that people want to hear, but sometimes it's important to sort of have that as a mental model, because if you're running a sprint, you know you go at it a certain way. And if you're running a marathon, you know at mile 3, you got to pace yourself, right? And sort of, breathe through it a little bit differently. Other questions?
I think
Or
those have
not?
been most of the, I think those have been most of the questions. I do anticipate that people are going to have more questions as they come up. I'm going to encourage people. I'll collect them. People have questions that come up. I can sort these out with Dr. Rocker and get back to you. So feel free to email. Kids should feel free to email me, and I can be in touch with Dr. Rocker if you have these kind of questions. And I think we should do another event like this. This was like tremendous. I've really. All the thanks in the world to Dr. Rocker for spending time with us. And I look forward to being able to set up another meeting, hopefully, which will kind of explore some more questions people have and just gain more information. I appreciate the level-headed and kind of like appealing way in which you're able to explain this to us as kind of like teenagers. And I think we really owe you a debt of gratitude. So thanks a lot, Dr. Rocker. Really appreciate it. Thank you, everybody, for joining us.